underlying cause, maybe a drug, so withdraw the drug, maybe a toxin. If there is a toxin, give the antidote of this toxin. For example, if there is paracetamol poisoning, give an acetylcysteine. Okay, so that will be the first step. Identify the cause and treat according to the cause. Then the supportive management. First of all, maintain the fluid and electrolyte balance. And if there is renal failure, treat the renal failure and treat the complications, the electrolyte imbalance, an acid-base disorder that comes to renal failure. For the liver failure itself, the direct consequence is a coagulopathy. So if there is a risk of bleeding and the PT is very high, you can give IV vitamin K. And if the liver failure is very severe and it meets the criteria for transplantation, we have to prepare the patient for transplant. Additionally, we want to keep the bowel movement going on, and we want to prevent any GI bleeding. And that's why we give PPI, proton pump inhibitors, and we reduce the protein intake of the patient, and we also give lactulose. The protein reduction helps us to reduce production of the ammonia and ammonia-like toxic end products from the gut, and lactulose helps the bowel movement. We also avoid sedatives because sedatives tends to complicate the situation. So we avoid using sedatives. And if the patient has evidence of cerebral edema and signs of raised ICP, we might want to give IV mannitol. And obviously, we will give the patient oxygen and supportive treatment, especially if the patient is hypoxic. And along with this treatment, we will continue the monitoring of the patient, as I have mentioned in my previous video. The monitoring parameters will be kind of similar. Monitor the heart, cardiovascular system, respiratory system, monitor the brain, monitor the nervous system, monitor the fluid balance, and screen for infection. So another treatment part may be adding an antibiotic, especially if there is suspicion for infection. We will add antibiotics to treat that infection. And usually this antibiotic is a broad spectrum antibiotic.